Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this video, we're going to be talking about the medications that I personally use to help me sleep or to treat insomnia. So since starting this channel, we've talked about many different medications that can be used to treat insomnia or to help individuals sleep. And we're going to talk today about 3 medications that I personally use. So the first medication that I use for insomnia is Zopiclone. The second one that I use less consistently would be Loxapine, which I talked about in another video titled My Favorite Medication. And the third medication is an anti-anxiety medication known as Clonazepam. So with these 3 different medications, there's different reasons that I would use one over another. The first one that I'll discuss is Zopiclone. This is the medication that I use the most consistently. I've been using this medication now for about 3 to 4 months each night. Typically, you wouldn't use this medication that consistently, but I kind of fall into a special category where sleep is extra important for me, just in the sense that I do have bipolar disorder, and it's very vital that I do make sure to get 8-hour sleeps each night, because with bipolar disorder, on the path towards mania, sleep seems to be the first thing that people lose track of when they are becoming manic. So the main reason that I have insomnia is pretty much because I have anxiety over not getting a good night's sleep, because in the past, when I've had manic episodes, I've had 5 manic episodes now, like I said, the first thing to go seems to be sleep. I can recall during different episodes going 3 or 4 nights without getting much sleep, maybe only 1 to 2 hours, and that would kind of push me further along the path to mania and eventually end up in the hospital. So I do have a lot of anxiety when I get in bed, putting a lot of pressure on myself to really make sure I do get a good sleep. So for that reason, I do use Zopiclone or Imivane on a nightly basis. It's prescribed to use 7.5 milligrams, either 1 or 2 tablets at bedtime as needed. And like I said, I've been using it quite consistently. The second medication I'm going to talk about is Clonazepam. I discussed this medication in a couple previous videos, especially one where I discussed how I treat my anxiety. So if I was using this medication, the first thing I'll say is I wouldn't also use Zopiclone. And this medication would be reserved for times in my life where I'm experiencing high intensity anxiety over a long duration of time. So if I was experiencing anxiety day in and day out, I would not take the Zopiclone and I would use the Clonazepam 0.5 milligrams, typically 1 or 2 tablets at bedtime. So far, since using this medication to help with insomnia, I haven't needed to go up to 2 tablets. I've been fine with just 1 tablet. And typically when I use this medication for sleep, I would only use it for about 3 or 4 nights. And then I would usually go back to the Zopiclone. If that fails, then I would go switch back to the Clonazepam. Now the third medication, Loxapine, is an antipsychotic medication that I first was introduced to in the hospital during the psychosis phase of mania. So this medication is pretty much my saving grace when it comes to sleep. If I try the other 2 medications for different reasons and I don't get a full 8-hour sleep for multiple nights, maybe I get 6 hours one night, 5 hours the next, I will drop the Zopiclone, I will drop the Clonazepam, and I will use 2 tablets of 10 milligram Loxapine, and this will pretty well knock me out. In the next morning, I kind of have a hangover effect from the medication because I'm taking it while I'm not in a state of mania. So it's really pushing me down, and it does have a quite severe effect. But it's a good thing because, like I said, I do need to make sure I stay on top of my sleep to prevent manic episodes from occurring. So this medication really does save me when I have those couple nights of not getting a good night's sleep. Now, aside from the medication, there are some other things that I usually do try to help me sleep or to get through that insomnia. So usually having a nightly routine that I do, have a glass of tea, get in bed with no distractions, no cell phone, no TV on, and just make sure that the bedroom is set up as a place for sleep and nothing else. Sometimes I'll try doing a meditation before I sleep when I get in bed to try to help calm my nerves a little bit and get ready for sleep. And also, if I'm not falling asleep right away, I might get up and get a drink of water and then get back in bed to try to reset that falling asleep process. I do feel very grateful to have all 3 of these medications as an option, so I can choose the best one in a given situation. So like I said, just for consistent sleep day to day, Zopiclone. If I can't sleep due to anxiety over having another manic episode, I can choose Clonazepam. If I don't sleep a couple nights in a row, I can reset that using Loxapine. I have covered all 3 of these medications in different videos, so I'll link in the description to videos about these medications if you're looking to learn more about one of these individual choices. And I will ask a favor of you, if you like these types of videos where I talk about my personal experience with medications, just leave a like on the video and I can use that as an indicator to see if you guys want more videos like this. All right, that's all we're going to talk about today with what I use to treat insomnia, talking about Zopiclone, Clonazepam, as well as Loxapine. Like I just mentioned there, you can leave a like on the video to support the channel or subscribe to the YouTube channel. That's it for today. Take care.